Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, president of ClearFile, and today I'm excited to present our newest topic, the 2027 Notice of Benefit and Payment Parameters, also known as the NBPP. And while we won't be covering every single topic this year, we have carved out what we believe to be the top topics to cover that will impact issuers of all sizes, both large all the way down to regional and even startup issuers that are entering the market for the first time ever in plan year 2027. So with the NBPP being released on February 9th of this year, this marks the latest it's ever been released since the inception of the ACA, not to mention that it has not even been finalized yet, with the proposed federal comment deadline to be closed on March 13th. Now, if we look at the NBPP on a timeline over the history and the lifetime of the ACA, generally it's been released in Q4 of that current plan year, where issuers would obtain the draft rule based on performance of issuers that past 11 months of the calendar year. Then those issuers would have an elongated period of time to work with stakeholders such as government affairs associates, legal team, and assessing impacts all the way down to your product, IT, benefit configuration, network development, enrollment teams, and other, even down to utilization or care management. Generally, plans would work also with their health plan associations, with their memberships such as AHIP or ACAP, to unify one voice. There is strength in numbers when it comes to commenting on federal rule, because when we actually walk back this process every year, it takes a lot of time, resources, and materials to review, research, and comment a formal position on this federal rule because issuer strategies change every single year based on market and the landscape. So for highlighting what could arguably be the largest topic in the NBPP this year, the proposed removal of standardized plan design requirements as well as plan count limitations. And what makes this particular section such a high priority for plan year 2027 is that this topic has been in the NBPP for the past number of plan years. We do know that 2 to 3 plan years ago, CMS did strengthen standardized plan design rules for very specific reasons and also did limit plan counts to improve healthcare literacy on healthcare.gov, specifically for a couple of reasons. When we go shopping on a website and actually having a sound number of plans that a member can actually digest, walk through with the complex language that a health plan is, understanding your deductibles, your cost shares and copays, CMS did limit all carriers and issuers to not have any more than 90 plan designs for any given submission within the individual marketplace on the federal exchange. That's enrolling within healthcare.gov on the FFE. So it's interesting, right? So when we look at the actual dissemination of standard plan designs and the elimination or proposed elimination up to March 13th this year when that comment deadline closes, issuers could take advantage of this strategy. Now, it's really interesting because more is not always more for the member. We always believe that having a more sound, of course, compliant, but then also rich portfolio for your member that could also be profitable to your business will keep that engine running for you and for your ACA book of business. As we see issuers enter new markets, there are aspects of having a primary seat on healthcare.gov. We do work with issuers where it's not uncommon when a member filters to shop based on a number of criteria. For example, you can filter based on star rating if your plan has 1, 2, 3, 4, or 5 quality stars for your ACA portfolio. Generally speaking, when you finish your application and you first get in, enter your zip code and your demographic information for your household, healthcare.gov will bring you to carriers in alphabetical order. There are limits to how many numbers of plans show on one page. So as a convenient shopper, it's really important to understand your member's behavior. So working with your marketing team on how a member will click through or actually understand how they get to your plan and add it to their cart doesn't always mean that they will actually effectuate that plan, which is a fancy word for paying their first premium, because far often members will add it to their cart. They will not complete that first point of sale shopping experience. So really it's making sure that you understand your member behavior, looking at trends maybe by HIOS ID to track your members if they're in those same plans in past years. What's your top performing plan by price or even benefit design? Really looking at that, you may not necessarily have to offer volumes of more plans just to have that space on healthcare.gov. It's going to be an interesting year, but it'll be important because also for that matter, looking at the complexity of what even removing standard plan designs are. Because we can look at some markets based on if you are a state-based marketplace or an FFE, standard plans could in fact be a carrier's top performing plan. Because standard plans are designed for a reason. They're there to ensure compliant benefits that align with any individual state's EHB benchmark, right? Because we all know that the federal government, CMS, has the 10 core EHBs, but then states can implement their own EHBs that they believe members in their state should get for medical coverage. That's very valuable. So standard plans have a reason. They're an anchor plan for many carriers. They improve a lot of business. So wouldn't be too quick to jump to get rid of those plans and modify complex plan designs. Because if you think about this, just really think about this for a second, the NBPP was released the latest it's ever been. In order to create compliant, complex plan designs that are not standard, it takes time, it takes research, analytics. And again, this will be a year where plans are under much more scrutiny by state reviewers. So really, in an effort to limit objections and perception with your regulators for participating on their exchanges, maybe this is something that it's a year of planning for your plan and then implementation next year based on the first year performance of how this year goes. And just finally, one large message for the bigger carriers out there that participate in, multiple states, 5, 10, 15, or even 20 ACA marketplaces in the individual or small group place. You may have had aged HIOS plan IDs that have been out there for multiple years for dormant plans with different metallic tiers, and what the perception of elimination of standard plans may be. And I guess the encouragement for issuers to create new plans is I would caution you to think twice about reusing those aged HIOS plan IDs that are actually in your plan preview in your HIOS portal. And we would highly encourage you, if you did go down this path to accommodate CMS or to take advantage of this option, to generate new HIOS IDs, because that could dig up a little bit of hardship with regulators when we talk about plan ID crosswalks, because again, HIOS IDs are a direct correlation to your member. And if you reactivate a plan and they come up, just don't want to cause any more work for yourself that you don't have to. Second big topic is the expansion of the catastrophic plan offering. Historically, working with many states, specifically state-based marketplaces and exchanges, there's a rule or a rule of thumb, I guess, in a general way, where all carriers must be prepared generally at any point in time to administer a catastrophic plan if there's not one offered in the marketplace by anybody else. So it's the lesser of, really. And this all ties into your risk adjustment of how you get paid back from the government and CMS if you do take on and bear that potential risk from your catastrophic members. It could be a strategy for you. Again, it's a more longer term strategy. You have to manage it very specifically, but I truly wasn't expecting this. So the concept of a 10-year catastrophic plan, and I can't take credit for this. Big shout out to our partner, Greg Fan at ACA. When I asked him the question about, hey, Greg, the rate setting for the traditional ACA product includes all metallic tiers, right? Yep. That's platinum, gold, bronze, expanded bronze, and also catastrophic. So when you talk about pricing for a product that will live for 10 years, how does that even work? Well, it didn't even occur to me at the time that the catastrophic plan with the elimination of subsidies could actually become the cheapest plan in the ACA metallic tier portfolio longer term by becoming the new benchmark for cost of coverage. Because with the expansion or perhaps unlimited limitations for maximum out-of-pocket values or increased deductibles, I personally can't think of a hardcore benefit for an issuer and or a member unless if this is a core part of your strategic portfolio. For many issuers, this will be very hard to implement. I would say it's part of your core strategy. So I would really work with your state to truly understand, who intends to offer that catastrophic plan and actually may be interested in implementing a codified strategy for up to 10 years. And I think the final message here for this one, I just want to make very clear is, as a reminder, while the catastrophic plan offering is proposed to exist for up to 10 years, calendar years, the notice of benefit payment parameters is updated on an annual basis every 12 months. So again, we just talked about plan design standardization and plan counts. That's changed multiple times on an annual basis. Just keep in mind, if you do go down a path and invest in implementing this catastrophic plan offering, that could be subject to change next year, the following year, or many years down the road. So be nimble, be adaptable, but also work with your regulators to keep a close check on this one. And onto one topic that we felt was very important to share with our issuer partners and all of our audience members is SEP verification and enrollment changes for plan year 2027. It's very important to know now, while enrollment was shortened for plan year 2026, that will continue in perpetuity until further notice. But then again, what needs a little bit more attention for members, which could fall to the wayside, which we do not want you to deprioritize through this year, is SEPs. Right, because enrollment we generally associate with November 1st, not for a number of more months in the year, but we really need to be thinking about this now, especially as it relates to the 75% of pre-verification that will need to happen, or that carriers will need to accommodate for this year. So generally speaking, we look at this here at ClearFile as a positive outcome for members. It should be improving the experience by having a quicker speed to enrollment, less questions, ideally less calls into issuer health plan call centers or third-party vendors, which ultimately we all know would lead to reduced complaints, reduced escalations, and any interactions with ombudsmen or any of the defenders for the health plans. That being said, while this would be a benefit that we believe for the members, it will cause what we can estimate to be a significant amount of increased work operationally inside of the health plan, specifically for reporting. With any system verification or pre-verification, we can already know that there will be IT enhancements needed for any enrollment verification systems that you utilize. What we first recommend you doing is evaluating the process in which you have today of how you track your enrollment. The second most important thing that we advise you do is really harness and look at and have a good understanding of where your members fall previously, the last calendar year, and currently within the current plan year of the federal poverty level. The percentage ranges that are put forth by CMS that really tell you where your member falls in from an affordability schedules perspective, based on their income, based on their location, and a few other factors. What that's really going to do is really give you insight quickly into who and or maybe which member pockets would qualify for SEPs without this calendar year, giving you an early look at how you can manage that member population. It takes a long time to communicate to members, it takes a long time to draft communications, and again, leading up to 11/1, there's a lot of other activities that occur that could distract your priorities. Don't let this be one of them. And it will be one thing to stand up this process operationally internally, but don't forget that the process, once established, needs to be maintained. So we recommend also dedicating resources to developing policies and procedures, because we do know that enrollment readiness does come up in audits where you do have to produce documentation about who's enrolled when, how you manage policies and procedures, and also reporting. We expect that states will also request specific levels of reporting regarding SEP verification or pre-verification. So just be prepared with any system changes. We know that that will impact your reporting, because enrollment at this point should be fairly standard for your organization, where you have routine reports on a monthly, quarterly, or annual basis by metallic tier. So just be prepared to document your business process and have some level of dedicated resources to that project. So what we also have seen over the past number of plan years is a slow but common theme of states converting to become state-based exchanges. Now, that's just one of many market shifts that we're going to see this year, where it almost appears that by way of the plan year 2027 NBPP, CMS is relinquishing a bit of power in a few certain focus areas specific to states converting to state-based marketplaces, having more control over individual network reviews, and a few other components that we'll get into. I think it's really interesting that CMS is starting to propose the allowance of states to convert to SBEs more quickly, but I also think that it's a great idea and will be highly beneficial for states and also members, ultimately speaking. But let's get into this a little bit further. There are rules in place that CMS put forth since the beginning of the ACA, and they were there for a reason. So generally, the FFM, or the Federal Marketplace, was the primary source of enrollment by way of healthcare.gov for any ACA member. State-based exchanges have been formulating over time, where states can adopt more control and retain more process over the enrollment of a member within their given demographic. When we look at this also, the purpose of a state-based marketplace goes far beyond just an operational hub or distribution channels for members to enroll into plans. It's almost like a community for health plans within that state. Again, Building a state-based marketplace creates jobs within a state, not just dozens, but in some cases, hundreds of jobs that can actually generate positivity for that economy within that state to improve healthcare outcomes and also balance budgets across state department agencies. Another reason why state-based exchanges are so valuable, and especially as it relates to improving health outcomes for members, is that states have the ability to retain more control over creating more policy that can supersede CMS's FFM policies. So that whether that be creating new benefits that could be richer for members that carriers are required to offer, even if it's more expensive for the carrier and less expensive for the member. And another important factor of having a state-based marketplace is advocacy, and advocacy for health plans of all sizes that may even make a state more attractive for carriers to enter, creating a healthier competition across carriers that could standardize price and standardize transparency for members and also for the health plans and state regulators. Now, contrary to that, I do want to talk about, well, that's amazing news that states will have this availability to do this. The process is not easy. It takes time, and there's a reason why that there was a period of time where states would work with the FFM to stand up this process. It's not just as simple as one carrier entering a new state where it's a one-to-one relationship. We think of it as like a Venn diagram, where it's a one-to-many relationship, where it's one state-based exchange having to communicate, ingest, integrate all the data filings across rates, forms, and binders for many carriers across the board, whether that's 4 carriers or the average carrier number in the state, all the way up to 8, 9, or 10 carriers. So it's essentially standing up an entire company in less than a year. Maybe a year. Would encourage states, as they're considering this plan, if you've already had a multi-year plan to convert to an SBE, you're already ahead of the curve and you have a plan you can implement quicker, let's put it in force. If you're a state that's just considering the adoption of an SBE, I would call some of your other state regulators that are already SBEs. They can implement or help share context of how the process works, and that'll unfold as the NBPP is finalized and as this comment period concludes. And what I found most interesting for the next topic for marketplace shifts was CMS allowing states to conduct their own individual network availability and adequacy reviews that could occur outside of the standardized federal network adequacy review process. While CMS has invested significant amounts of resources over the past number of plan years into strengthening these rules and increasing the threshold that issuers must need to make up to 35%, conducting their own reviews, even going to the extent of increasing the validation functions of the ECP network adequacy tools, the validation portal in NPMS, including the cross-validation workspace, which has increased multiples of the number of errors we've received for issuers this past plan year. What the plan year 2027 NBPP is proposing is more flexibility for issuers. I think that this is a great outcome for issuers who have struggled with meeting network requirements for the past number of years. Essentially, in the most layman's simple terms I can say this possible, is issuers have to meet 15% less network requirements than they've ever had to meet in the past number of years of the ACA. So for new issuers entering the marketplace for the first time ever before, this is going to be the best for you, because instead of contracting a 35% compliant network of PCPs, specialists, facilities, and providers, you only have to meet 20% of that total 35%. That could be a matter of hundreds, if not thousands, of contracts. And not even to mention American Indian or Alaskan Native provider network contracts that are very hard to get. This is great news for any new issuer, and almost could be incentive for issuers to enter the marketplace who may have considered, hey, it may be too hard to contract a network. Because again, we estimate that it takes about 12 to 18 months to stand up a network compliantly. We anticipate less errors this year or versions of the network adequacy template, simply because we don't have to meet the requirements that we had to meet in prior years. That should not preclude issuers to contract the most strong network that you can possibly contract. You should be contracting up until May 1st, May 15th, and also the June 1st submissions where the adequacy portals will be opened. But then again, it's interesting, right? Because CMS now is just implementing the ability to conduct network reviews. But if I didn't mention it, just to be clear, now it's for all states. We also know that some states have already conducted their own network reviews, such as New Hampshire, for the past number of years. Now that's the minority. The majority of states do not do this. They follow the CMS model. But then again, from a state regulator perspective, states like New Hampshire on their federal exchange already have a process for all the issuers in their marketplace. This actually may not have little to no impact to those regulators, as that's the same process today. We would see and expect friction from other states that are trying this for the first time because they have to stand up that validation process. This may mean new filing requirements that have to go into SURF, new templates that never existed before. States are just starting to release guidance as we enter March. So again, it's going to be a little bit of a dance. If this is something you'd like more control over for your state, again, maybe something to build a process for this year and truly implement into next year. And just some final thoughts as we wrap up. Recognizing the notice of benefit and payment parameters is a behemoth of a document. What we've covered today are just a few key components that we felt were incredibly important that could accommodate issuers of all sizes. We do know that some of the larger issuers out there may care about some other components on a deeper level, such as routine adult dental, or even diving in a little bit more to non-network plans for that creative approach where they have more resources. But then again, really taking these key topics and diving into these will be beneficial for your organization. Also having a conversation, leveraging your health plan associations, and documenting impacts across your organization are going to be important. Again, we're in the comment period. The NBPP is a living and breathing document once it's final. You have to implement it throughout the year as it touches each and every month up until December. Thanks again for listening in, everybody. Give us a like, give us a share, and we'll see you all next time.